Today, the Supreme Court upheld the individual insurance requirement at the heart of President Obama's health care overhaul. Now, Americans will find out if that overhaul actually works. The president says the overhaul will give medical coverage to millions of uninsured people while keeping costs low. Republicans say they don't buy it, and they'll keep pushing for a repeal, but shift their focus from Washington to individual states. Under the law, states play a key role in delivering new health insurance coverage to millions of lower income and middle class people.
So what does it all mean for you? Health reporter Alyssa Ivinson has more now on what some experts are saying.
Well, it pretty much depends on your situation, but people I talked to today expect premiums to go up and some small businesses to drop insurance benefits.
If the decision was to throw out the whole thing, would have wreaked havoc with employers.
Some of President Obama's health care reform law is already in practice, covering kids to age 26 and better preventative care benefits. But the major changes come in 2014. Now that the Supreme Court gave the green light, everyone will have to have health insurance, and employers have to offer it or pay a penalty tax.
For those people who have individual pre-existing conditions and can't get insurance, it's a great thing.
But Greg McDonald expects premiums to go up.
Not only because people who had pre-existing conditions and couldn't get insurance are now going to be insured, but I think the big thing that most people don't realize, the bill has a minimum level of coverage clause in it. So those people whose plan does not meet that minimum level, they're either going to have to lower their deductible, which will increase premiums, or they'll pay a penalty for that as well.
The immediate result to employers is that now that the decision's out, it puts it back on the front burner.
Tom Markle is an attorney specializing in health care benefits. He thinks a lot of small businesses will drop their benefits and pay the penalty.
Because that would be cheaper than what they're currently paying for it.
The true effect of the reform remains to be seen. It partly depends on what the federal health care plan looks like. And as the details develop, what's best might vary from person to person.
Insurance is confusing. Get in touch with their agent. Help. Just ask questions. A good agent will explain what they need to know and will guide them through this process.
The effect on private insurance companies will also depend on what the federal plan ends up looking like. And right now, 850,000 Hoosiers are uninsured. That's about 13.4% of the state.
All right. Thanks, Alyssa.